Hypoadrenocorticism in canines. What is Addison's disease? Addison's disease is an endocrine disease that is caused by the primary adrenocortical failure. It's not definitive what causes the failure, but is assumed to be immune-based, which means that the immune system attacks and damages adrenal glands. AD is the lack of cortisol and aldosterone being produced. This is typical Addison's disease, and atypical Addison's is just a deficiency in cortisol. The cortisol hormone is involved in stress response, regulating metabolism, glucose levels, immune function, and regulating the balance of electrolytes. About the disease. The photo is of some breeds that are predisposed. Causes of Addison's disease. One can be hereditary, which means it's inherited by one or both parents in genes and allows for the predisposition for the disease to occur. The effects of medication means that dogs can develop Addison's if they stop a certain medication too early or the medication malfunctions. For example, if they are on prednisone and they stop it suddenly, it can fail to pick back up those cortisol levels. A lot of times when dogs are being treated for Cushing's and suddenly stop the medication, it turns into Addison's disease. And tumors and cancer. Addison's disease is secondary to the pituitary gland tumor, but the tumor itself will decrease adrenal function, which mimics the signs of Addison's disease. Animal/species affected. The disease can present in humans, canines, and felines, but for the sake of the project, I'll be focusing on canines. Based on inheritance, some breeds are predisposed to typical Addison's disease, which means that it presents in the drop of cortisol and aldosterone, which affects the electrolyte levels. But the Nova Scotia duck-tailing retrievers, standard poodles, Portuguese water dogs, and bearded collies are predisposed to the inheritance. Non-inheritant dog breeds are poodles, golden retrievers, terriers, Rottweilers, Great Danes, and West Highland White Terriers. While females are recorded more by 64 to 70% of cases, males are less than 30%. The average age of a dog being diagnosed with Addison's and presenting with the symptoms are 4 years old, but they can be diagnosed from 4 months to 14 years old or up until death. The major body systems affected are the endocrine and renal, but the adrenal gland is part of the endocrine system, which is the biggest factor in this disease. The adrenal gland is a gland in front of the kidney or caudal to the kidney, and this gland connects the endocrine and nervous system. The major symptoms of Addison's disease is lethargy, anorexia, vomiting, diarrhea, weight loss, increased thirst, increased urination, trembling, weakness, dehydration, hypoglycemia, hyperkalemia, hyperatremia, and hypophobic collapse. The photo is the diagram of the endocrine system, which shows you where the endocrine gland is in proximity to the kidneys. Normal physiology. Responsibilities of adrenal gland and adrenal function. It regulates blood pressure, vascular tone, GI function, motility, inflammation, the immune system, decreasing in wound healing, epinephrine, norepinephrine, and aldosterone, which covers water and electrolyte balance. The adrenal glands are small organs next to the kidneys that produce cortisol and mineralocorticoid, which is aldosterone. The outer layer of the adrenal cortex maintains water and electrolyte balance, and aldosterone increases in response to hypovolemia and hypotension, which then stimulates aldosterone synthesis and secretion. The glucocorticoids, which are the cortisol type drugs, which is cortisol, are synthesized and secreted under regulation of the hypovolemic pituitary adrenal axis. That means that releasing the hormone CRH is released by the hypothalamus, and this release of ACTH from anterior pituitary gland. ACTH stimulates synthesis and releases cortisol. It inhibits the release of CRH and ACTH, which is by a negative feedback, which stimulates appetite, which means makes you more hungry. The job is to maintain a normal blood pressure, make sure that the stomach is functioning properly and having enough water intake, as well as contracting the stomach for motility. It also suppresses inflammation and its inability effect on the immune system, so it decreases that. Disease physiology. How is the system altered? In Addison's, there is a cortisol and aldosterone deficiency, which means that cortisol and aldosterone are low in quantity. The pituitary gland is damaged or ineffective, so the necessary hormones needed all around the body are imbalanced, including electrolytes. Electrolytes are affected because potassium, sodium, and chloride are not able to be in quantities that are needed throughout the body. Potassium slowly builds up and causes the heart to slow down or beat irregularly, which can result in shock, which is 50 beats or less per minute of the heart. Cortisol results in moderately low blood sugar, and atypical Addison's can cause hyperglycemia but have normal electrolyte levels simultaneously. Tumors of the adrenal medulla often have no signs, and the tumor is found by chance, but can explain the symptoms for thirst, urination, tachycardia, restlessness, distended abdomen, and are usually diagnosed by ultrasound. Diagnosis and treatment. Diagnosis of Addison's disease is very difficult because the symptoms present as many other diseases and have to be backtracked to get to Addison's. The diagnosis is usually by an ACTH hormone test that is instructed by the adrenal gland to produce cortisol, and the test is to test cortisol before the injection and after, and seeing if the cortisol levels change. Also, blood and urine tests to see the electrolyte imbalances. Treatment is usually hormone therapy, so cortisol and ADH, and prednisone is given as a daily steroid, which is supplemental for cortisol. The ADH is supplemented with injections once a month, which is usually Zycortal. IV fluids for hydration, which also helps with glucose. But PRN, glucose, or insulin may need to be given based on animals' needs. Pro and prebiotics may be needed to help with GI upset from the symptoms. Explaining symptoms. Hyperglycemia, hyperkalemia, hyponatremia, and hypovolemic collapse. Hypoglycemia is low blood sugar because low cortisol causes glucose in the liver not to be released, which means the insulin being produced cannot remove glucose from the blood, so it is stuck, therefore reducing the blood glucose levels. Hyperkalemia and hyponatremia are high potassium and low sodium because cortisol and aldosterone cannot regulate the electrolytes in the blood. Hypovolemic collapse is when fluid level drops so low because aldosterone isn't regulating fluid or water in the body. Anorexia, vomiting, diarrhea, weight loss, and increased thirst are caused because the inability to manage the function of the GI tract and mobility. Water is not able to be processed correctly, which means the stomach is not having that at disposal with fluid, and it can lead to stomach ulcers. An animal is not able to regulate water, again, so it is very thirsty because the body is telling it that it needs that, even though they are urinating frequently. The hormone imbalances causes lethargy, weakness, trembling, and they're present because cortisol and aldosterone regulate energy levels. Thyroid stimulating hormone, which would trigger hormones that would determine how the animal's food would be used for energy, cannot be efficiently carried out. Literature used. These are my sources for my research, my sources for my images.